Janelle Shepard, health coach, personal trainer, and host of Sweat and Sunshine. I'm here to deliver inspiration and solutions to living the healthy lifestyle you've always dreamed of, despite the challenges life offers up. As your wellness guide and supportive mentor, I'm here to motivate you toward healthy behavior change, educate you when you request it, and empower you to take responsibility for your health. Tune in as I share posts from my blog and deliver bite-sized episodes of health and wellness, motivation, education, and empowerment. Please be advised, I am not a medical professional, and the suggestions given in this podcast should not be considered medical advice. Rather, my goal is to assist you in developing strategies that result in sustainable behavior change. Please check with your healthcare provider before beginning any diet, exercise, or health routine. Welcome to Sweat and Sunshine Wellness. Today we're exploring ways that we can fight chronic illness with our fitness routine. Thanks for joining me for Combined Cardio and Strength Training to Fight Chronic Conditions. When we think about exercise to manage conditions like diabetes, cardiovascular disease, and hypertension, it's common for people to focus on cardio. One reason may be because weight loss is key to managing and preventing chronic conditions, and there's a well-established misconception that burning more calories by completing tons of cardio is the answer to weight loss. A research-backed approach to decreasing body fat with exercise requires us to take two approaches. We'll need to burn more energy and build muscle. Build muscle to burn more. As previously mentioned, weight loss is important in managing and preventing chronic conditions. Losing just 10 pounds can reduce A1C levels, improve HDL and LDL, lower inflammation, and improve insulin action. The more muscle we have on our bodies, the more energy we'll burn with everything that we do. So as we increase muscle mass, we increase the effectiveness of every workout and create a greater energy deficit. With a greater energy deficit on a regular basis, we're able to lose weight. Build muscle to prevent insulin resistance. The benefits of strength training don't stop at weight loss. They also include musculoskeletal function, balance, heart health, and can surprisingly prevent and reverse insulin resistance. Insulin resistance, also known as prediabetes, is a major cause of type 2 diabetes. According to the CDC, approximately 96 million American adults, more than 3 in 1, have prediabetes, and more than 80% of those don't know they have it. How does it work? Once we use up the stored energy or glucose in our bodies during a workout, we'll begin using the energy in our liver and blood. Over time, this uptake improves blood glucose control and reduces the risk of insulin resistance, delaying or even preventing type 2 diabetes. Build muscle to improve lipids, blood pressure, and heart health. Strength training can also positively affect lipids, blood pressure, and heart health, lowering our risk for dyslipidemia, hypertension, and cardiovascular events. Strength training stimulates enzymes that move LDL cholesterol from the blood to the liver, where it's digested or excreted. So the more we exercise, the more LDL our bodies expel. Regular physical activity will make our hearts stronger. This will allow us to pump more blood with less effort, decreasing the pressure on our arteries and lowering blood pressure. Strength training also improves the muscle's ability to pull oxygen out of the blood, reducing the need for the heart to pump more blood to the muscles. This will reduce stress hormones that can put an extra stress on the heart. Physical activity readiness and chronic conditions. Physical activity is generally good for most bodies. However, there are some instances when we should check with our physician before becoming much more physically active? If you could answer yes to the following questions, you should receive medical clearance before becoming much more physically active. Question 1. Do you currently experience signs or symptoms of cardiovascular disease, metabolic disease, or renal disease? Question 2. Are you a current exerciser with signs or symptoms who wants to begin vigorous activity? Again, if you've answered yes to either of those questions, possibly a good idea, or I should say likely a good idea, to discuss things with your doctor before you become much more physically active. Recommendations to get started. When beginning a strength training program, start small and look to make gradual progress. Just how much strength training is required to reap diabetes preventing benefits? A study published in the Mayo Clinic Proceedings Journal demonstrated that even moderate strength training and an increase in overall muscle mass were shown to reduce a person's risk of developing type 2 diabetes by 32%. Performing a full body, high-intensity interval training routine like the ones listed on this podcast notes page twice a week will do the trick. This is your host, Janelle Shepard, with a sincere thank you for listening. If this episode of Sweat and Sunshine has been helpful for you, please share it with someone you love. Until next time, keep it simple, sustainable, science-backed, and put self-care first.